AAHA has two categories of standards. One is mandatory and the other is points-based. First, let's dig into the mandatory standards. There are roughly 50 mandatory standards that make up a little over 5% of the total. These serve as the foundation of accreditation, basic but important best practices. Here are a few examples of mandatory standards to which you're probably already adhering. Anesthetic agents are administered by a veterinarian or trained practice team member under the supervision of a veterinarian on the premises. Practice team members wear protective apparel, including aprons, gloves, and thyroid shields, while in the X-ray suite during exposure. Pain management accompanies all surgical procedures. The practice has the means to administer oxygen on a periodic or ongoing basis for compromised patients. Surgical suites are separate, closed, single-purpose rooms entered only for activities associated with aseptic surgical procedures. Controlled substances are stored in a limited access, securely locked, and substantially constructed cabinet or safe. So that's a quick peek at a few of AAHA's mandatory standards. Pretty reasonable, right? Now let's dive into the other points-based standards. They're broken down into 5 major categories. By adhering to these points-based standards, your hospital earns points for each section. In order to pass, you must earn a percentage of these points in each section. To gather enough points to complete a section takes organization, teamwork, and dedication. One person can't do it on their own. Here's an example. As you can see, each standard has a certain number of points assigned to it. This gives practices the ability to choose the standards that best fits their practice type and philosophy. Additionally, AAHA uses a series of rule-out questions to further customize the standards to fit the individual needs of your practice. For example, if your practice uses digital radiography, all standards related to non-digital systems will be removed. As you start exploring the standards, you'll be surprised to see how many of them you're already doing. The ones you aren't would likely cause your practice to run more smoothly and are worth adopting. AAHA recognizes the diversity of veterinary medicine. In addition to general and referral hospitals, veterinary practices at universities, military bases, animal shelters, and even a zoo have chosen to meet AAHA's standards of excellence. Now that you know how the mandatory and points-based standards work, accreditation may be closer than you think. AAHA's accreditation team is committed to helping you achieve accreditation and is available to assist you every step of the way.